Good morning, good afternoon, everybody. We're in our breakout session 2 on animal and human health surveillance. I'm joined here by two VIPs from the One Health world, James Wood and Dennis Carroll. And I'd like to start by, for those of you who weren't in the previous session, please introduce yourself. Starting with you, James. Tell us where you're from, what sort of work you've been doing related to this issue.
Peter, thank you very much. It's a great privilege to be here. I work at Cambridge University. I'm an infectious disease veterinary epidemiologist. I work at the vet school in Cambridge. And my research in this context is looking at understanding the spillover of pathogens from wildlife, particularly bats, to humans, but not specifically just bat viruses, but more generally wildlife to humans in sub-Saharan Africa, but particularly Ghana and West Africa, where the majority of our work has been undertaken. I'd like to draw a distinction between that work in terms of pandemic risk infections from our work on agricultural neglected diseases such as brucellosis, where we know there's a major burden of disease which is largely neglected, but there's far less pandemic risk. And I think it's a useful way to think about zoonotics in terms of those that are really important, but don't threaten the whole world, but do cause major problems in local communities compared to those that threaten the whole world and maybe less threatening for the local communities.
Great, really good point. Thanks, James. Dennis.
Great. Well, first off, it's great to be part of this panel, James, Peter. It's good to be with you. Look, I've had almost a 20-year career really focused on what are One Health issues, and it's largely been overseeing development programs that I oversaw at the U.S. Agency for International Development. I was really focusing on how do we invest in the kind of systems and capacities we need across the wildlife, livestock, and human health sectors to build the kind of forward-leaning capabilities that we want. To say the least, it's been a learning experience. The evolution of our understanding of One Health has really been quite profound and dramatic. But the opportunity to be working in this space has also been, for me, started off as a public health professional, very much focused on human health issues, and moving into this space and understanding that many of these issues, you can't solve human health problems by focusing on humans. And we really need to build out this kind of multi-sectoral partnership. Multi-sectoral problems ultimately require multi-sectoral solutions and partnerships. So I've had this privilege and look forward to the discussion.
Thanks very much, Dennis. So my name's Peter Daszak. I'm the president of Eco Health Alliance, a nonprofit based in New York, US, where we conduct really research and outreach on emerging zoonoses in particular, trying to understand pandemic risk, trying to predict and prevent future pandemics. So I'm going to join in the discussion as well, because this is something that I feel very passionately about, and I know you both do. And what we want to talk about now, we've heard the in the last session, really laying out quite an interesting and deep discussion around what is known about zoonotic disease risk, particularly around flu, and how we can use what is known about it from a One Health context to design a better surveillance. So I want to get into that, in this breakout group. What should that One Health surveillance look like, that network? And how can we really move from, case studies from a research perspective, some of which you talked about, James, into truly a structure, a surveillance strategy for the planet that brings the best of this new science to bear on the planet? So my first question for both of you, and I'll start with you, James. What is needed for a truly global One Health surveillance network, and why haven't we got one yet? We've seen these case studies. Why aren't we using that to prevent the next pandemic, James?
Yeah, Peter, thank you. That's have we got 2 hours? I'll try and be brief. I want to focus on. I think that what I think that you both will go on and describe better than I can is how we have the technology. How actually, when we look at the cost of this pandemic, we can find the money if there's political will. what I want to focus on is something different, because and the key issue I want to talk about is things that go on locally. Peter, some of your previous work has identified significant hotspots for where many diseases are most likely to spill over and may therefore be the most likely places for pandemic emergence. In many cases, but not all, these are some of the poorest parts of the world, where there is little infrastructure and little resource of either human or animal health care. For me, a key issue, if we want to truly deliver One Health surveillance to prevent the next pandemic, as well as a lot of other things, a necessary but not sufficient part, therefore, is what happens on the ground in human and animal populations. I think that we need properly resourced primary health care in disease hotspots in the tropics. And I think that that's clearly a public good for the people living there. It is massively under-recognized as a global good in terms of early detection of pandemics. And those of you at the previous session will have heard me refer to a study where clear evidence was presented that 50% of Ebola cases, spillover events, are missed. We only diagnose Ebola when it starts transmitting between humans. If we want to pick up pandemics early and prevent them, we have to invest on things in the ground with local governments, local resources, local communities and local healthcare empowered to deliver that. And that's one of the key things that's missing in terms of pandemic prevention. It's not enough on its own, but I believe it's necessary if that's what we really want to do. Thank you.
Really powerful words. Dennis, can you pick up on that and tell us what your opinion is, and why didn't we have this system in place prior to COVID, and how are we going to get this in place to deal with the next pandemic, whether that's flu or another disease?
Great. Let me first off echo a point that James made. This is not the reason we don't have this capability right now isn't a technological one. All of the required technologies to do this work, they exist, and we know that they allow us to do it efficiently and even under the most arduous, difficult conditions. So it's not waiting for a technological breakthrough. It really is more to do with social re-engineering. Quite frankly, getting the different sectoral partners to really move out of their what are really stovepipe understandings or perceptions of the world. Public health people, medical people see human health as a human health issue, pure and simple. And the animal health people are largely focused within that space, and the wildlife people are largely focused. So one part of the challenge that we have isn't, again, technology. It's not about strategies. It's not about what we do. It's about tearing down the silos that really make it difficult for the professionals to be able to interact, understand that the problems that they have are shared problems that require shared responses. So part of it is a rethinking of the issues. So the ministries of health and ministries of agriculture and ministries of environment and all the people that populate that all the way down into the community level, there needs to be a rethink and an understanding that there is power to be had in coming together and building the kind of alliances. This isn't about public health and animal health and wildlife working together hip and hip on everything. There's certain issues that require convergent partnerships. And I would hope the social engineering can be facilitated by a couple of things. One, funding. That if we can get funders, both at the national level, but at the international level, to begin investing in these multi-sectoral partnerships and allowing for the kind of alliances and holding the funding outcomes based on moving those progressive ways forward would be really powerful. And right now I'm thinking about some of the legislation that is before the United States Congress, which is speaking to One Health and are raising the issues about making investments that specifically reinforce the alliances that we're talking about. So I think, one, getting the funders to really step forward and sort of incentivize how we can work together, and really get the leaders within these sectoral spaces, within human health, animal health, and environment, to really step forward. And really, that's about FAO and WHO and OIE, as well as all of the associated associations that are out there, to really be serious and not nibble at this around the edges. It's been a lot of nibbling, but not a really wholesale commitment.
Thanks, Dennis. Okay, this is clear to me, and you've talked about this repeatedly, both of you. But let's think. Let's provide a bit of context. James, you mentioned the study that showed half of Ebola spillovers are missing. We know that there are hundreds of outbreaks that are undiagnosed each year globally, any one of which could lead to a pandemic. So, have any examples that we can pick up around the world that shows a positive way forward, that shows how One Health has been used, where there's a platform set up to look at this that actually proves, gives us a proof of concept? Starting with you, James.
I think that there are a number of cases where this has been very effective, and actually we did touch on it in the last session, and that is the control of avian influenza in Hong Kong. Really intelligent, risk-based approaches and interventions which mitigated the problem. We saw belatedly the response to SARS, not SARS-CoV-2, but SARS, which removed the source, at least temporarily, of palm civets being fed into the human food chain. And Peter, I think that your work and others has identified the fact that a lot of these were probably farmed rather than actually wild palm civets. And I think that was a clear risk-based intervention in relation to animal trade, which was necessary to protect human health. There are other. Those are ones where it's been possible to deal with things through regulation. I think what's far harder is where we're looking at One Health approaches which require social or behavioural change. And a good example, I think, of a fantastic risk-based approach is that of palm sap tappers in Bangladesh, who have been presented with a really cost-effective, locally available, free, other than a bit of time, way of stopping date palm sap being contaminated with urine infected with Nipah virus. And we know that can be effective, highly effective, but my understanding is the uptake of that, and Peter, you can, I'm sure, comment on this much more informed than I can. The uptake of this across the region has not been high enough. And it's not sustained sometimes where it is. And I think some of these things that require behavioural change, particularly in the absence of resourcing, where perhaps what's needed is another form of livelihood, without wanting to socially engineer, I think those can be much, much harder. But I think that your insight there, Peter, would be really interesting.
Well, actually, interestingly, I think, Dennis, you were involved in your role at USAID in funding some of that work and trying to roll out those programs and see if they work. So any thoughts on that? First of all, on the palm sap strategy to prevent that spillover, but also on this, are there any other tangible examples where a One Health system has been set up in a country and is being used to try and get ahead of disease outbreaks?
Well, there are some really good examples out there. Again, avian influenza, as Wang Jing mentioned in the previous panel, really was a catalyst for really bringing these different sectors together. And we've seen in countries like Thailand and Vietnam, for instance, sustained engagement across those sectoral spaces. Thailand is a brilliant example of how national leadership has brought the different ministries together, but also the private sector towards addressing the issues around animal husbandry, particularly poultry production, and incentivizing and penalizing, those practices that really minimize the risk of the introduction of viruses. There's a lot of reasons why Thailand is doing this more successfully than most, but they've built on that experience and have established one of the most forward-leaning One Health alliances in any country that I'm aware of. And they've been very proactive in moving this forward. And it's worth noting that they're also quite proactive in sharing their experiences to neighboring countries as a way of building up sort of a regional approach towards this, because they also understand, for as much as they protect their own well-being with the animal-human dynamic within Thailand, if they sit in a sea of uncontrolled viruses across the borders, they are continually at risk. So I think Thailand is an example, but I could point to a number of other countries that really, coming out of the avian influenza experiences of 2005, 2006, really catapulted the agenda of One Health in a really dynamic way. There's still an enormous amount of work to do. But that said, we've seen how it can be a powerful force within a country, and it can be brought together, not just the different ministries, but also the private sector as well.
Yeah, really good. Look, it's very interesting. You both talked about the public good, the global good. James, you talked in the previous session about countries where diseases often tend to emerge being sometimes have much less resources than the countries that end up being affected by them most, because their economies depend on this globalized system. So what are we going to do about that? How do we provide incentives for a balancing out of this problem? This clearly is, viruses don't check passports and check out what nationality you are before they infect you. How are we going to think like a virus? And Dennis, you talked in the past about know thine enemy. How are we going to know our enemy and on a global scale when we're fighting amongst ourselves for jurisdictions over different geographic spaces? And look, you talk about a bill being put before Congress. Why should the richer countries pay for this when often these diseases emerge in other countries?
Well, if you need an answer to that, right? If you need an answer to that, all you have to do is look at COVID-19. The old, what has become an old, adage, a threat anywhere is a threat everywhere. I mean, we never said that 20 years ago. We say it repeatedly over and over today. So it's not just about being a good neighbor, investing in these capabilities. It's about your own well-being as well. There's no event that can happen anywhere in this world, and not just respiratory viruses like the coronavirus or influenzas. We saw graphically with what is typically a very localized virus, Ebola. Given world travel dynamics, the events in West Africa, 2014, underscored that epidemics now have the potential to become global epidemics. So you can't just invest in your own, within your own borders. It is really to your self-interest to invest in the capacities that will stop these events in their track, prevent them from happening in the first place by making sure we have better interactive dynamics at that animal-human interface, but also having the surveillance systems in place that allow you to pick it up, not as we did in China in December of 2019. The fact is that virus should have been picked up months earlier when it was in far fewer people. But we don't have that kind of surveillance system. It's about pivoting from an event-based surveillance system, or not pivoting, but expanding beyond an event-based surveillance system that is really being able to look at pre-event dynamics, emergence, and threats, and exploiting, Peter, the work that you and your teams have done in helping us understand about hotspots, that you can focus in certain geographic areas and monitor sort of high-risk viral families, not which virus, but what geographic area and what interface where spillover is most likely to occur. It's all about our behaviors in certain high-risk spaces. Focus on those, and we can pick these up earlier. So it's a matter of will as opposed to a matter of how.
And what you suggest there is significant return on investment if we can stop outbreaks before they become pandemic. James, look, this is great because we're stretching our minds here, and I have great respect for veterinarians. You are a veterinarian, and veterinarians have a true One Health perspective. You look at systems actually, rather than in just individual patients. So I want to ask you to expand on what you were talking about earlier on. Why, if we think about the UK or the US and we look at how this might be balanced out, or maybe the European Union, how is this an issue of we're just going to have to pay a tax forever on our consumption patterns and somehow then have to send money to other countries to protect ourselves? Or how do we truly build this out as a system so that it functions and it operates without the constant need for outside support? Any thoughts on that? And you've worked in some resource poor countries yourself that maybe you can draw on.
Yeah, so this type of conversation always reminds me of a discussion I had with the head of medical surveillance in a country in sub-Saharan Africa, when a colleague and I reported to him that we had found evidence of Ebola in his bats. There was no evidence of spillover into humans in that country, and there hasn't been subsequently. And he looked at us in a rather nonplussed way, and it was like, "What do you expect me to do about that?" And I'm faced with a massive problem of under-resourced care for my HIV and my TB patients who are ill today. Are you saying, and the question was left hanging there, effectively what he was asking was, should I remove resource from those people who don't have enough resource already with ill health to invest in something which might not be effective in any case, to prevent a theoretical risk of the future? And of course, it's not something that someone like me should have an answer for. It's not for us to prioritize the healthcare budgets of other countries. I think one of the things that I hope will come from this pandemic is an understanding, however, of the need to invest in healthcare, primary healthcare and surveillance in countries where pandemic emergence is more likely than it is at home. Because we have such clear evidence in front of us today of the cost effectiveness of this, if it can be effective. So I think I see our role is to sell what we can deliver, and I think the argument around cost effectiveness will make itself if we can seize the moment now. 5 years ago, I don't think we could do that, but I think that there's a real opportunity now for us to move beyond the international health regulations, which are very well intentioned. But to my mind, when I've seen them in action in terms of countries that have signed up to them and the resources they have to really deliver these things on the ground, I see them as being totally inadequate in terms of, the intention is good, but I think that one of the problems with having a system that countries sign up to is you can sign up to things in a way that theoretically allows you to be able to tick the boxes, but actually has no capacity on the ground for genuinely delivering the intention, the spirit of what those IHRs are written to deliver.
All right, well, let me push you a little bit on that, James, first, then we'll go back to Dennis. There's a lot of talk about a pandemic treaty. There is already, there are proposals for revision of IHR. I agree, there is a moment in time right now where people are looking at these structures, global governance around emerging diseases, and finding them lacking. We clearly failed with COVID. on many different levels. And it's already been stated by the independent panel reporting back to WHO. How are we going to fix this? How are we going to move beyond just response and preparedness to truly preventing pandemics, to really getting into what you were talking about in the last session?
Well, I think that one of the problems that you're just touching on now is we have a moment in time now where we can do this. I think one of the things that we need to deliver in this moment of time is sufficient early warning to remind people all the time that this problem hasn't gone away because it's not an active pandemic. We remembered this for 6 months after SARS in 2003, and then we forgot it because other things became more important. And I think that this is where I think actually it would be interesting to move the discussion a little bit onto some technological issues of the ability to deliver genomic surveillance much more simply. Now, you can make arguments, and I think both are strong actually, about surveillance in primary healthcare in humans. Let's pick up the infections that have jumped, even if they're not going to transmit between humans, or actually preparing by doing a lot of surveillance in many different animal species. And I think that both have very strong arguments for doing them. I think both need testing properly in a way that see, actually in a comparative way, to see what we're going to find, because that will inform the best way to take things forward. But I think there are huge opportunities for using the technology we have now to start thinking much more about surveillance, and that may provide an ongoing justification that goes beyond our memory of this pandemic, which within 2 years, touch wood, all the hope that I have will have diminished massively. Because I think our memories are so short, we need to have constant reminders of these things that enable the politicians that we depend on to deliver these decisions, to give them the ongoing impetus to say it's still there. And that's one of the things that I think is really hard to deliver. And I think that's where active surveillance programs will be really important.
Really, really interesting. I mean, Dennis, politicians love to respond heroically to crises, and if they do it well, it's great for their votes. But a politician who says we're going to spend US dollars in foreign countries to help them prevent a pandemic that people believe is once every 100 years, that's not such a great strategy for winning the next election, maybe. So how are we going to do this? So what we hear from James is, yes, we need revision to the IHR, we need a pandemic treaty, but we need to move beyond that and start to really crystallize out what preventing pandemics should be. So in your mind, Dennis, how are we going to do that? How are we going to get to a crystallization of pandemic prevention strategies, whether that's flu or all other potential pandemics?
Well, I think first off, we need to grow the circle of stakeholders that are part of the discussion and part of the investors. Really the low-hanging fruit here, if we think about influenzas for a moment and the critical role that livestock play in both the evolution and the amplification of influenza viruses as they journey towards that pandemic endpoint, is really doing a much better job in bringing together traditional funding mechanisms along with very strong partnerships with the private sector, and to build into trade regulations and everything else, all sorts of incentives that first off really improve biosecurity measures so that animals don't become sort of the amplifiers of the next influenza pandemic threat. But it's also to the advantage of the food industry because, those measures that improve or lower the risk of influenzas being introduced into a livestock production system also protect against other potential microbial threats as well. So we have to, begin growing the circle, but based on mutual benefit. That the endpoint isn't always a pandemic. The endpoint could be the Africa swine fever outbreak in China that had such devastating impact, not just on the food safety, but the whole issue about food security as well. I mean, pork is a major source of protein, and having that disrupted, really, there were some severe consequences. So I think we need to think differently about how we open up this discussion. It's not, first off, simply about pandemics, human pandemics and human epidemics. It is about the shared health of animal populations and human, and you can't break them apart. So bring a better representative cross-section of the stakeholders in that, and really see the cross-sections of where things are mutually beneficial. And, this ultimately, the resource pool has to increase. The pie has to get larger. James's point about the constraints on the public health system really need to be taken to heart. So we need to grow the pie, but that's not simply looking at governments doing that. And I think we need to be much more creative and innovative in how we frame the challenge and frame the discussion, and who it is that sits around the table as a way of strategizing about how we build the big partnership that moves beyond this. The risk we have a year from now will be COVID fatigue. We saw this after H1N1, flu fatigue, and money for pandemic preparedness fell off the table. I mean, dropped dramatically, the amount of money. We have the same risk coming up with COVID. And to get out of that, we have to look at a much broader circle of partners and players.
James, you were going to...
Yeah, there's just one cautionary note that I'd add. I mean, I think that you're absolutely right, Dennis, that we need to work out a way of bringing in a far greater number of players here as stakeholders, and actually including the private sector around agriculture in particular, but not just around agriculture. The only note that I would raise is in relation to the challenges of biosecurity and animal disease, because typically, although you talk about incentives, but animal disease historically has been a way of blocking trade, and removal of it has enhanced trade, but often then extensive discussions follow. And you both know this very well. And so I think one of the problems is that we know that there are hotspot countries where investment's really needed. The more infections that we find there, the harder it is going to be for them to trade their animals, and then to use the private sector growth in that sector to deliver sustainable change in the way that we really need. And I haven't got any easy solution to that, but I think recognizing that as a challenge is important.
Well, couldn't that be? So one sector, Dennis, you talk about the private sector. It's not just agriculture. Think about insurance, biotech, travel. So isn't there a way to provide some insurance backing, and sort of, in the way that insurers understand risk, that a country that is doing good surveillance, that is reporting, therefore gets a higher score as a on some sort of insurance measure. I mean, in the same way that the global health security agenda and the GAEE was supposed to do that with countries around human health. Is that a strategy?
The best example that I've seen of how insurance, involving insurance companies as being a catalyst for really blocking disease spread, was actually in Iran during the 2005-2006 avian influenza. When the H5N1 virus swept into that region, it decimated poultry flocks across. And the Iranian government their response to this was really interesting and unique. What they did was basically enter into a partnership with the local insurance companies within Iran. And they guaranteed that they would provide the kind of inspection and oversight of poultry production to adhere to OIE biosecurity standards, which would really lower the risk of potential introduction and outbreaks. They would provide the guarantees, they would oversee this. The insurance company then had the responsibility of underwriting any losses should there be an outbreak. And so this partnership really within a few months, the amount of outbreaks in Iran, even as Armenia and Georgia and the neighboring countries were still inflamed with avian influenza, plummeted. And it required that the government followed through and did the kind of due diligence in overseeing and ensuring the kind of poultry production. And I would say the government also said to the poultry producers, if you're not compliant, we will shut down your operation. So there was a carrot and stick piece here. But it showed fundamentally that if there is responsible action to give the insurance companies the guarantee, they want to have a low risk sort of investment here. We have to find who's going to ensure that low risk and bring the insurance companies into play. So this is where you bring those institutions that have the ability to focus on the systems and capacities to lower the risk, and the insurance companies to underwrite then the insurance costs associated with that. So it's one example, but it was a brilliant one, and it was incredibly impactful.
Well, it's these are not simple issues to solve, and people are going to have to be creative. James, you talked about the wildlife trade, and Dennis is thinking about the food production in the wildlife farms of China and its role in SARS. But we also know that by the time COVID emerged, those wildlife farms across China were employing 14 million people. An incredible industrialization, essentially, of a production of wildlife, live usually, for food, shipped around China into markets, into places like the Huanan seafood market, where we found evidence of that in the WHO mission recently. So China closed them down. I mean, they really, on February the 24th, they put out an edict to close down the production of domestic wildlife for food. But other countries haven't done that yet. And these are, deeply ingrained systems that are profitable, that are culturally agreeable. There's a great market for these products. How are we going to fix this? And where's the role of conservation in this? Is one of the stakeholders that's missing conservation? And how do we measure the benefits of that? And how do we incentivize that? So, James, you first.
Yeah, Peter, that's a really hard question, and one area that I find very hard to have a clear differential is what is wildlife farming compared to normal agriculture. Yeah, all animals started wild. Obviously, we've had generations, centuries of domestication for some species, but I struggle to find a clear differential that is justifiable to all, or sufficiently justifiable. I think that the issues around one of the great things about agriculture is that it is possible to regulate it, in particular around animal disease. And I think that in some ways there are benefits in having farmed system compared to particularly when we're talking about feeding large numbers of people. Without going into the arguments of what the best source of protein for human health is over the whole population, which is far more complex than I think we've got time to deal with today. So I think that the issues around farming are not so much the species, but it's the biosecurity around the farming system that is critically important, and that is often overlooked, and it's often suboptimal. Whether we're talking about flu or SARS, original SARS, but I think there's far more that we can do with the technology that we've already got here. I think the issue of wildlife for food is a very important cultural one, moving away from the farmed production. And one group of peoples, indigenous peoples around the world, traditionally have wildlife as a very important source of meat and are not responsible for the pandemics. And I think it's really important that we make sure that the measures that we develop do not discriminate further against the discrimination they already suffer in nearly every country in the world where there are still indigenous peoples. You're right that conservation is a very important part, because I think there's increasing evidence in terms of what might be a long-term driver of pandemics, rather than how do we stop date palm sap getting contaminated with Nipah virus, which is a very proximal cause. But the longer-term causes actually do relate. I think that there is pretty clear evidence, and it's growing, to relate to biodiversity loss. I think that this is where it's critically important to recognise that people are an important part of biodiversity, and not think that we can't have that we can have biodiverse areas without peoples on them. In many cases, the best guardians of biodiversity are the tribal or indigenous peoples that have been living in those areas since time immemorial. And I think that's one of the mistakes that conservation organisations are making in far too many places still, that we should be looking at removing people from biodiverse areas, because actually it will have exactly the right, apart from it being wrong, I think, in a moral sense, I think it will be ineffective and actually dangerous and counterproductive in terms of all the things that we're trying to achieve.
Really good answer. I mean, look, it's not straightforward. These are complex issues, and just closing systems down generally doesn't work. Dennis, I want to ask you about flu in the same context. Influenza viruses, we know, share genetic elements between wild birds and domestic birds. And if you go to some of the lakes that are breeding ducks or growing ducks for sale, where they're released out onto a lake, you see them mixed with wild bird flocks. Can this be done on the scale it's done? I'm talking about poultry production in a way that reduces that risk of interaction between wild and domestic birds. And why isn't it being done? Has farm biosecurity increased over the last 2 decades, or is it just considered okay till there's a pandemic? Dennis?
Right. Look, James would know this better than anyone, but we think of poultry production as sort of a static number. The fact is in the latter part of the 20th century, the amount of poultry that was under production dramatically increased across Asia. And they essentially went from small holdings to large production operations, but not necessarily bringing with them the kind of biosecurity that would protect the flocks from these interactions between wild birds. So part of was the huge transition that went on, particularly in China, where with the economic liberalizations that went on and people having disposable income, the demand for animal protein skyrocketed. And you can see it in the numbers of poultry that were produced. They were largely adhering to traditional practices as to how they grew them. There's a transition afoot now, obviously, across the region, where more high intensity industrial production is a much larger percentage of what poultry production is made up of now. And so with that, you begin reducing the opportunities for these interactions between wild birds in their migratory paths and the free range ducks and chickens that may be out in pasture. It's a transitional period that we're looking at. But with that said, it's still a period of great risk, and how you in the interim, lower that risk. James talked about risk a lot in the last session. This is about risk reduction and lowering the opportunities for these events to occur. So I think, one, there's a natural sort of evolution in production practices within the region that over the next decade may reduce this dramatically. But between now and then, we have some real challenges ahead of us. And how do you incentivize the acceleration of good biosecurity practices in a way that will be embraced by the farmers? That's an interesting challenge. I think James probably has a lot more insight to that than I would.
Well, I appreciate you your insight there, Dennis. And I want to ask James, we've got a question from the audience, from Maria Dimitrova. If conservation is a sector that needs to be engaged with, how do we engage with it? One Health seems to be so focused on health. Are we doing enough to reach out to conservation groups? Is this happening right now? Just a couple of examples, James.
I am not aware of conservation groups being fully integrated into these conversations, or conservation as a sector. I do think that there is a risk that there's a risk here as well as a benefit. Clearly, we need to conserve biosecurity. Whether the model that particularly these large, wealthy international conservation organizations have, which is of national parks, many of which have no people in them, and without going over the history of the US national park system, which I'm sure the audience knows better than me, but in most cases, all of those parks had peoples living in them before they were removed in order to make the national park. And I think I have great concerns about the 30% of the world by 2030 model, which is driven by organisations which have been removing people from tiger reserves and the Central Congo Basin in Cameroon and so on. I have real concerns about those organisations driving the system towards saving the world from pandemics, because I think they're going to make it more risky. And I think it's we've got to change that model. And that's where we have to engage with conservation organisations to get them to do it better. I think that it's what has been happening isn't good enough. But at the same time, recognising we need to stop biodiversity loss. And actually agriculture is a major driver of that as well. I mean, particularly if you look in the Amazon, and beef production there and soy production, which is mostly used to feed the growing number of pigs around the world. That is a major driver, I think, it's both of biodiversity loss, but also directly of pandemic risk because of the putting animals in very close contact with disrupted environments, which may be more likely to drive pandemic virus carrying species.
Brilliant. Well, that's pretty controversial issue, and I really appreciate your comments there, Dennis. I'm going to, we're getting towards the end of the session, but I want to ask you a couple of questions specific to your projects you've worked on. Dennis, you're the chairman of the board of the Global Virome Project. Full disclosure, I'm a board member. I think it's an amazing, visionary program to go out and discover 70% plus of the viruses that are out there on the planet, the maybe 1.7 million or whatever the number is out there on the planet that we don't know about yet that could become pandemic. But there are problems with that. And we heard a little bit about this in the last session. How do we triage? When, let's say you discover 1,000 viruses, you get the sequences. What do you do then? How do we work out which ones are going to be high risk? How do you triage them? Is there a strategy for that? And why isn't this happening? Why isn't this ingrained in our system? Dennis?
Well, first off, just to be very clear, when you're talking about going out and trying to identify viral threats, you're not talking about which is the next virus that's going to be the threat. What you're doing is, first off, exploiting, again, the work that you and others have done, Peter, which is to help us understand where hotspots are, where the risk of spillover is greatest, not exclusive, but where the risk is greatest. So this is all about risk-based strategies, right? Go where you identify the risk of spillover is greatest, understand what is circulating in that hotspot, in wildlife, what is the viral profile and what does their host profile look like, and understand what the interactive dynamics between the host and human populations or livestock is within that locality. And then focus your surveillance on those viruses that are in a situation where they have a potential to spill over. Obviously, you're looking for viruses that have near neighbor affinity with known threats. So work that you've done, Peter, looking for coronaviruses that have, near neighbor proximity to SARS 2003. You found a range of them very, very similar to the current SARS-CoV-2. Those are the kind of viruses you would want to track and look to what extent, that ecology of emergence is at work, where that virus is in a species, in a location that is proximal to livestock and people. And this is about pre-event surveillance. You're not waiting for the outbreak. What you're doing is waiting to have telltale signatures that this virus has jumped and it is moving in a direction, so that if in fact it jumps into an animal that ends up in wildlife trade, you want to track the value chain of that trade to understand whether or not the virus is part of that trade. And then you can intervene and isolate the virus within that value chain domain. So it's, you sort of alluded to this earlier, which is know your enemy. Sun Tzu famously said, know your enemy, you'll be victorious in every battle. You don't know your enemy, you'll lose every battle. We know about the viruses when they hit the front page of the New York Times, and that's what we react to. This is about going to the virus before they come to us and track and follow, very much like looking at weather depressions out over the coast of Senegal, and understand which might become tropical storms, which might become hurricanes. You track and follow, and then you prepare. In this case, we can track, follow, and prevent when you understand that one of these viruses, one has an ecology of risk, but also you look at its genetic profile and you see it has a high risk genetic spike protein profile that says you really want to pay attention to this. So the GVP is about exploiting what we know about risk, special, viral, and geographic risk, and behavioral risk, and bringing all of this together, which means you talk with conservationists, you talk with livestock people, you talk with human health people, and you work in all these domains simultaneously.
And basically, both of you said this, that these approaches aren't an either or, that we need this preventative, proactive approach, as well as the containment response strategy, all strengthened. James, over to you on this. Your work on Hendra viruses in Africa, I find fascinating. Hendra virus were discovered in the other side of the world, essentially, known to be highly pathogenic in people, have caused outbreaks, have evidence of human-to-human transmission, clearly on the cusp of emerging more broadly, Nipah virus in particular. And you found them in Africa. There's evidence of spillover into people. There's serological evidence in some folks. I think there's evidence in livestock too. What do you do as a government of a country in Africa where you see this clear and present danger? What can we do now? What's your advice? What's your strategy so we don't end up in 10 years? Well, we knew it was there, but we didn't do anything about it.
Yeah, Peter, that's a really good question that I think I asked you last when we were sitting in a pub in London. And I don't think you gave me
Now it's my turn.
I'm not sure you gave me a very good answer at the time, or I certainly can't remember it. But joking apart, that's a really tough problem, and it actually goes back to the issues of funding and governance that we were talking about earlier. We have done that work that you described, demonstrated that risk, that presence, that spillover into both agricultural and into human primate species, but it's not causing a problem. It's not causing any known problem at the moment. Whereas there are plenty of diseases in this under-resourced setting that are, and it's I think very hard for us to go on producing more and more evidence of disease in countries that are far away from where we comfortably live, without actually providing a solution. And at the moment, I think that we can try and help come up with behavioural solutions in relation to improve biosecurity around agriculture, to try and prevent the really close contact between humans and the pigs that they farm, or between humans and bats. And actually the Ebola epidemic and the understanding in West Africa and the understanding that came from bats almost certainly really helped with that biosecurity message. But it's not enough. And this is where I think we're going to go back to thinking more about international funding if we want to protect our international health. And actually, I do think that it's a sensible investment. I don't think I'm not trying to suggest there's a moral imperative, but I think there's a sensible investment for wealthy countries that will be very badly impacted by the next pandemic, as they are by this one. I think it's great for them to think about investing in public health and preventive measures under a One Health framework in countries in Southeast Asia and Sub-Saharan Africa, because I think it will pay them in the long run if we can help reduce the risk of pandemics occurring in these hotspot zones.
Hear, hear. All right, look, I want to finish off with trying to get a couple of inspirational comments out of both of you briefly. As you sit, let's say a few decades ahead, many, many years in the future, when you're sat on your rocking chair out on the veranda, thinking back on what happened following COVID, what is your vision? And what do you hope? Briefly, Dennis.
Well, first of all, Peter, I'm already in a rocking chair on my veranda, so I don't have to fast forward 20 or 30 years. Look, what I first and foremost hope for is we've had a series of what you would call shots across the bow over the last 2 decades. This century has been riddled with alarms going off, and each time we don't really learn from the last experience and really embrace it. I hope COVID-19 is that teaching moment that really transforms the way we think about these problems and understand the solutions require sustained multi-sectoral partnerships and investments, period.
James.
The only one thing I'd like to add to what Dennis has just said is that I think that it's absolutely essential that we work to collaboratively to help build the institutions in the areas where they're most needed and where they're least strong, and that is in low and middle income countries. And I think that building that local self-governing capacity is of critical importance and is not receiving enough attention. In fact, I'm embarrassed by part of the UK pandemic response has been to massively cut overseas aid, particularly in the area of pandemic response and AMR. And I think this is such a short-sighted, mad decision to have taken. And that's what I'd like to see. And that for me is what success will look like. And it doesn't look like it at the moment.
That's just fantastic. Look, the prevention is always the hardest thing to do in public health. We've achieved it. You go in a bar in London now, and it's not as smoky as it was when last time we met and had a pint. And there's a reason for that. That the correct behavioural risk was analysed, the incentives were provided, and we did it for the public good because it costs us so much in mortality and morbidity if we don't push and nudge and carrot and stick approaches. What you're both saying is we need to now do this on a global scale for our own good. And that, no country is an island on this, even if we are an island, James, like the UK, especially now after Brexit. We are linked together by our ecology, by our consumption patterns, and by our viral dynamics. And COVID has driven that home in the most egregious, nasty way. And much as we now criticize and fight amongst nations, we're going to have to think different for the future. And I really appreciate both of you for your inspirational, as always, words. And I look forward to getting back, now we're all going to be vaccinated, in person, to sharing another drink in a pub somewhere in the world and thinking more deeply about this and hopefully pushing through some of these brilliant agenda items. Thank you very much, Dennis Carroll. Thank you very much, James Wood.
Thank you, James, Peter. Have a good day.
Well, Dennis and Peter, thank you both very much. It's been a real pleasure to be here. Thank you.
Cheers.